Hey everybody, this is my presentation, and hopefully it isn't going to take as long since I'm recording it. Um, I was I was in the Dardanelle ER and worked with Marlena Craig. She's a great teacher. I enjoyed having her, and I learned a lot from her. We had some good talks whenever we didn't have any patients. We talked about everything from health insurance all the way to the HESI test. So I enjoyed her a lot, and the patients over in the ER, we had everything from an acute MI all the way to a rash. We had lots of chest pains, lots of nausea, vomiting patients. We had a few seizure patients, and some UTIs, and some low back pain. Had a lot of those, and we had several people who had lacerations on their heads, and we also had a drug overdose, and I got to talk with her, and I feel that our 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 time was very therapeutic. A common problem over in the ER is that many of the patients had multiple visits in the ER over the course of about 2 months, and they had reoccurring issues, injuries, illnesses, and we talked about it over there, and we believe it's due to one of a few reasons. Either a lack of education on the patient's illness or injury, a lack of resources to help them manage them properly, or general non-compliance, or non-adherence to the medical and nursing regimen. My Um, uh, we also had patients who had non emergent illnesses and injuries, and we encouraged all of them to rather than making a trip, um, to the ER to make an appointment with their primary doctor to reduce their overall cost, particularly with patients who have no health insurance, because a trip in the ER, it's really pricey, and they could save hundreds, if they opt to go to their regular doctors, and my article actually, it involves the recurring patients in the acute care setting, and it helps us realize ways to help reduce their number of visits, and we did a whole lot of patient education on illnesses and injuries, and in our short amount of time with those patients, we tried to talk about ways to help manage those, such as smoking cessation, weight loss, having exercise routine, things like that, and some courses that's helped in my nursing practice. Algebra, I've had to have those math skills to do the med math, psychology. That's a huge area that nurses have to in incorporate into their practice. I had to use a few of the principles while talking with my overdose patient. Microbiology, and of course all of our nursing courses, intro to nursing, all the skills, all the theories, pharmacology, all the drugs, all the interactions, the side effects. We have to know those for safe nursing practice. In the clinicals, that's important. We have to have that practical or the practical ways to have our nursing knowledge put into practice. And that's about it, I guess. And in in conclusion, I have to tell y'all how much of a blessing each of you has have been to me over the past 2.5 years, and all the help, all the patience, and all the kind words. I appreciate it, and I love all y'all, and I know that y'all are going to be great nurses. All right, thanks.